There's a specific one called a novel coronavirus, which means a new coronavirus to the humans population. And so that's what this is, COVID-19, COVID-19. An example would be the case in recently New York yesterday. You had some cases in California, and Washington State, and Oregon over the weekend where you have someone who doesn't have a known travel history. And then they presented with that ill manifestation where they have lung disease and they've gone to the hospital. And then we kind of talked to that epidemiologist, talked to that person who presented to the hospital. Then they test who they've been in contact with, and we may find that the family members involved, their neighbors involved, and that's where you have community transmission. And it's a different situation where they're screening at the airports just with questionnaires, or they're screening people that are coming in from a high-risk area. The short answer to your question is no. I don't recommend anyone buy a face mask. I'm not wearing a face mask outside of the hospital where I have to because someone might be here for the flu or some other reason. My children aren't wearing face masks. My parents have asked. I'm not recommending they wear a face mask. And so, people I get that question probably at least a dozen times a day from just generally people on the street or just other communications. And I don't recommend people wear a face mask in general. However, if your immune system is not healthy because you're receiving chemotherapy, you're on a medication because of psoriasis or other treatments that affects your immune system, or if you are on oxygen and you have advanced COPD and you regularly see a lung doctor and you might be on prednisone or a steroid, then those people, they should consider wearing a mask with high-risk exposures. Would be like in a group setting, like at a church or an area where they're exposed to more than 50 people in a specific location. In any situation, use common sense. If you can stay home, you drink plenty of fluids, then do that. If you're having a high fever to 101, 103, you're feeling dizzy or lightheaded, you're feeling short of breath from walking from here to the front door or walking to your car, then that's a situation that you want to go to the hospital just like you normally would. But be aware that you should say those if you're going to the hospital, whether it's your doctor's office or the ER, you tell them truthfully what your symptoms are. So that person that's seeing you, whether it's a nurse or a physician, can kind of protect themselves so we don't get the healthcare workers sick. So you tell them ahead of time. Good resources would be muschealth.org. That has up-to-date information, as well as the South Carolina DHEC and CDC.